Hi, Dr. David Kulla here with Synergy Wellness to talk about ganglion cysts today. Ganglion cysts are the most common mass or lump that you would see in the hand or wrist. Good thing is they're not cancerous. And in most cases, they're harmless. They usually develop on the top or the underside of the wrist, but they can also appear at the base or at the end of the joint of your finger as well. Basically, they're a fluid-filled sac or cyst that can quickly appear and sometimes go away just as quick. They change in size also, and also in symptoms. For many people, they're asymptomatic. Many ganglion cysts don't need treatment or don't require any treatment, but if the cyst is painful, interferes with your daily living, then of course, you're going to want to treat that and take care of that. Now, there are several treatment options available for you, and we're going to go over all of that today, both surgical and non-surgical. A ganglion grows out of the tissues surrounding a joint, such as ligaments, tendons, sheaths, and joint linings. And inside the cyst is a thick, slippery fluid, similar to that fluid that you would find which lubricates a joint. And again, they can vary in size and they can grow larger with increased activity usually. So with rest, the lump typically does get smaller, but not in all cases. It's known what triggers the formation of ganglions. It's not really known. They don't really know. They think it's an overuse injury, but commonly found in women. So women from the ages of 15 and 40 are more likely to be affected by ganglion cysts than a man. These cysts are also common among gymnasts that have had repeated stress on the wrist and hands due to their sport. Now, ganglion cysts that develop at the end of the joint on the nail side or the top of the finger, also known as mucus cysts. So that's another name for that at the top of the finger. And those are typically associated with arthritis in the finger joint and are more common in women as well, but different age groups. So that's going to be more the ages between 40 and 70. Okay, now most ganglions form a visible lump that you can see. However, smaller ganglions can remain hidden underneath the skin and you may not see them at all. And those are called occult ganglions. Although many ganglions produce no symptoms at all, besides the appearance or that lump that you might see on the skin. If a cyst does put pressure, however, on the nerves, this would make it more likely to see symptoms. Now, ganglion cysts rarely, if ever, cause permanent disability or permanent damage. There are several non-surgical approaches or several non-surgical treatment options. We're going to go over both the non-surgical and the surgical treatment options for you today. In the case of recurrence after surgery, a revision surgery can be performed to remove the cyst again. However, I do not personally recommend that. I personally recommend that you try a different approach. I recommend trying the alternative approaches first before even getting surgery. But should you have already gotten surgery or considering a second surgery, I would check out some of the newer non-surgical approaches. And we're going to go into those in just a minute here. X-rays will not show a ganglion cyst. They can, however, be used to rule out other conditions like arthritis of the hand or wrist, or worse, a bone tumor. Now, MRIs and ultrasounds can see soft tissue better. So if you want to find a ganglion cyst, you'd be better off doing an MRI scan or an ultrasound rather than an X-ray. Now, sometimes an MRI or ultrasound is needed to find an occult ganglion. And remember, that's that ganglion cyst that's underneath the skin. It's not visible. Or you may need it to distinguish the cyst from other types of tumors. However, further imaging is often not necessary prior to treatment. If you have no pain, let's say, and no symptoms at all, your doctor may actually just send you home and recommend to kind of wait and see. And oftentimes it goes away. They come and go, sometimes within days, weeks, months even. So they may just give a wait and see approach and, just keep an eye, make sure there's no unusual changes that are occurring. And this is typically safe because ganglions are not cancerous and they may disappear, as I said, on their own. Now, activity can increase the likelihood of that cyst getting larger for some people. So if you notice the size of the ganglion is getting bigger after you work out or exercise or had a heavy lifting day, gotta understand this cyst gets larger, it could put pressure on surrounding nerves, and it's a higher likelihood of it causing pain. So you don't want it to get larger. A newer form of treatment is called cold laser therapy or low level laser therapy. And this laser is great. It can help reduce the pain, reduce the inflammation, and reduce the size of the ganglion without surgical intervention. And this is what I would try first. Now, another option is just to try the wrist brace and a wrist splint. And that may not only relieve the symptoms, it may cause the ganglion to decrease in size because you're not using it as much. As your pain decreases, your doctor may prescribe some exercises to strengthen the wrist and improve the range of motion. And I've already done that for you guys today. So I've left at the end of this video my favorite exercises for ganglion cysts. Hang on, it's coming up in just a few seconds, okay? And I'll give you a couple of my favorite ones so you can get started on that. As long as you're feeling better and you're in that second stage where you're improving with your pain and your symptoms. Now, if the ganglion causes a great deal of pain or severely limits your activities, the fluid may be drained from that cyst, from that ganglion cyst. This is a semi-surgical approach or procedure, mildly invasive, and it's called an aspiration. So what they do is around the area of the cyst, they numb it and just some local anesthesia, and the cyst is punctured with a needle and the fluid is withdrawn or drawn out of the cyst. Now, unfortunately, a lot of times aspiration fails. They come back a lot because you're eliminating the fluid, but you're not eliminating the ganglion or the root of the ganglion, which oftentimes can connect into the joint or the tendon sheath. And when that's not removed, it comes back. So a ganglion can be almost like a weed, which will grow back if the root is not addressed. Thus, in many cases, the ganglion cyst returns after an aspiration procedure. Aspirations are most often attempted for ganglions. It's probably the most common for somebody that's symptomatic. But they're usually attempted on the top of the wrist, right here. When the ganglion is on the palmar side of the wrist, that can be much trickier to aspirate because there's so many major blood vessels there and nerves there. So it just depends on the size, and it's just a much trickier surgical intervention on the palmar side. Now, your doctor may recommend surgery if your symptoms are not relieved by non-surgical methods, or if the ganglion returns after aspiration. The procedure to remove a ganglion cyst is called an excision. Very simple procedure. I'd say on average it takes 2 to 6 weeks to recover. If you have laser done before, cold laser before and after, much faster. Now, the surgery involves removing the cyst as well as addressing the stalk from which the cyst arises. This may mean excising part of the involved joint capsule or tendon sheath to ensure removal of the root of the cyst. Even after excision, there is a small chance the ganglion will return. So you can understand there's a lot of, when you surgically intervene there are a lot of things also that can go wrong. So you want to use that as a last resort, okay? Excision is an outpatient procedure, and again, it is your last resort. Now, there may be some tenderness and discomfort after a surgery like this, obviously, and swelling, and you'll probably be able to, get back to normal duties after about 8 weeks, max 10 weeks. If you do cold laser, in half that time. So I hope this answers your questions about ganglion cysts, and hang on, here are my favorite ganglion cyst exercises for you guys to enjoy. Don't forget to give me that thumbs up, and I hope you subscribe. We've got 4 videos coming out every week. Thanks for tuning in.
Start in a seated position with your forearm resting on a table and your affected hand palm up. Keep your fingers relaxed. Use your other hand to lift the hand upwards. Hold this position. Start in a seated position with your forearm resting on a table and your palm facing down. Place your other hand on the back of your affected hand. Attempt to lift your affected wrist up, whilst resisting the movement with your good hand. Ensure you keep your forearm in contact with the table. Hold this position. Start in a seated position with your forearm resting on a table and your palm facing up. Place your other hand on the palm of your affected hand. Attempt to lift your affected wrist up, whilst resisting the movement with your good hand. Ensure you keep your forearm in contact with the table. Hold this position. You can sit or stand for this exercise. Rotate your wrist in a circular motion. Repeat this movement in the opposite direction. Hold a ball in your hand. Squeeze the ball as hard as you can and hold. Allow your wrist to move in whichever direction feels natural. Start in a seated position. Grasp a weight in your hand with the palm facing down and rest that elbow on a table or your knee. Start in a neutral position, then lift the wrist up. Control the movement as you lower the hand back down to the neutral position. It is important to keep your forearm in contact with the supportive surface at all times. Start in a seated position with your forearm resting on a table and your affected hand palm down. Keep your fingers relaxed. Use your other hand to lift your affected hand up, stretching the front of your wrist. Hold this position.